So let's go ahead and get started with the meeting follow-up. Does anybody have anything from last week's business meeting that we had? Any follow-ups, any questions for myself, Carter, Eric, any of the staff? Okay.
Mayor.
Yeah, go ahead, Pat.
So the only thing I've got after Representative Locke's comments, I really appreciated your comments.
Thanks, Pat.
And I wish I would have addressed some of those things, such as, when Alamand and Tony Locke trying to take away some of municipalities and counties and special districts' rights through that. I wish I would have thought of that. So if I get a chance in the future, if Representative Locke comes, I'll be sure to respond appropriately.
I have a response to that too, but I was going to save it to the end.
To the end.
Yeah, I wasn't here, so I didn't get a chance, but I did retroactively watch the meeting. So I feel like I've been with you all today already, watching it online. So.
Look forward to hearing it. Awesome. Carter, do you have anything for a follow-up?
I don't believe so, sir. Thank you.
Okay, let's move on. Spectrum. Carter, do you want to tee us up?
Yeah, you bet. Good evening, everybody. Good to be with you tonight. Council is aware that you had the interest in visiting with representatives of Spectrum to discuss the multi-day outage that we incurred a few weeks back. As a part of that, you also asked for some audience with Blue Peak, whom you've already met with in this setting, as a matter of fact, a few weeks ago. We now have the opportunity to have Mr. Morris here with us tonight on behalf of Spectrum to follow up that conversation with you as well. And so if it's okay with you, Your Honor, we can invite Mike up and
Absolutely.
have the conversation.
Mike.
Good evening, Council. I'm Mike Morris, Government Affairs Representative for Charter in Wyoming. Yeah, the outage was townwide, and it was a result of a fiber cut to our main hub, basically everything that feeds the town. Since that's happened, we've installed a redundant line. We were in the process of putting a redundant line in when that happened, and that went active last month in May. And so if we were to experience a cut like that again, it would seamlessly flip over to the redundant line and outage at all.
Okay. Yeah, awesome. Questions? Yeah.
Thank you, Mayor.
You're welcome.
Since in fairness to the rest of the council, I've been the one that's been pushing this. So my concern, number one, was why wasn't the line, according to Blue Peak, when they came and visited with us, it was not indicated that there was a line there when they did everything they were supposed to do on tracking that before they dug. So I wanted to try to find out that. And the other issue was redundancy, which you've already mentioned, but.
Yeah, Councilman, I'm not sure why they didn't know it was there. They did the 811 locates and everything else, but yeah, it was definitely a different provider and not related to our redundancy line or any work that we were doing that resulted in the cut.
So follow up.
You bet.
So I guess the question is, to try to find out is why wasn't it a recorded line? Because that's what they indicated to it.
Yeah, our Councilman, our main line into our hub is definitely a recorded line. Yeah, that's the main artery that comes in that serves Casper. is recorded, it has to be.
Okay.
Yeah, Michael.
Thank you, Mayor. So my question, the question I have heard repeated a couple times was, if it was an internet outage, why was that what affected the cell phone service and why was that? Do you know that information?
The cell phone, I wasn't aware of that.
It
The
affected
cell-
like
cell-
Verizon, maybe
Oh, yeah.
uniquely or particularly, I'm
Well,
not sure. But
Councilman, we wholesale Verizon. So, although it's a Spectrum product,
Sure,
we use their towers, basically use their service
I see.
to provide cell service. Voice over internet, phones in your home,
Go ahead.
the voice over internet, the phones in your home are all as a result of fiber. Those are internet lines.
So just to clarify a little bit, so there was an outage of Verizon cell service. So it wasn't limited just to Spectrum cell service. I understand it, I'm a Verizon customer, so I lost both internet and cell service. My Spectrum cable, but Verizon cell, so if you're using their service or,
We use their service, yes. Spectrum is, we wholesale their product and sell it as our service.
So that's why they're connected. Is that what you're asking, Michael? Why, how was it connected
Well,
with Spectrum and
yeah,
Verizon?
but I guess
can
what I'm
answer that
confused is
question.
I
can answer your question,
Go ahead,
Mike.
Michael.
I used to work for Spectrum. When I was
Yeah.
working for Spectrum, we were told that Spectrum's fiber optic is what runs the Verizon towers. So they buy
I see.
wholesale fiber service from Spectrum. That's why Spectrum was able to piggyback on their towers for the Spectrum mobile
I see.
service.
Okay, that clarifies. Thank you.
Thank you.
Thanks for your patience.
Any questions for Mike?
I do have a handout. It's just kind of our footprint here in Wyoming.
Mayor, if I can.
Yeah, you bet.
So, I am appreciative of everything that Spectrum and Charter does with the Boys and Girls Club and other organizations. And I think the redundancy, in my mind, will really help. And one of the things I was concerned about was 911, what would happen there, but people don't just tend to pick the phone up and test that. But the chief has gone through that with us, that still would work in any case, but but I know I'm Verizon also, and so lost that service, and so we're at the office. I was online at that time, and so that portion didn't go down because we're with CenturyLink down at the office. So, but anyway, do appreciate you coming and visiting. So,
Councilman Sweeney, absolutely. Don't mind at all. And, look, there'll be an announcement probably this week on another community program here in town that we're going to support.
appreciate that.
Anything else for Mike? Mike, we really appreciate you coming down and chatting with us. do appreciate everything you guys do for our community. Thank you, appreciate it. Okay, point in time count. Carter, do you need to set up anything?
Sure, you bet.
Okay.
Council has asked a number of times what the results were of the January point in time count, and we have the opportunity to hear from Ms. Wessels tonight, who will walk us through that effort and give us some data that you've been interested in, which of course has a lot of implication with regard to other services and so forth that we seek out on behalf of the homeless population here in our community. And so with that, Mr. Mayor, if I could turn the time over to Kelly to walk us through that, that'd be great.
Hi, Kelly.
I didn't know City Council was interested in the presentation that many times. I know the Homeless Coalition has asked. And unfortunately, every time they ask, I happen to be at a homeless conference, which is really caused problems. But I am really glad to be back with you. I actually brought some handouts, so if you want to go ahead and take those, you're welcome to have them. I'm Kelly Wessels. I'm the Executive Director of Community Action Partnership, Healthcare for the Homeless, and I also have the opportunity to be the person who helps coordinate the point in time count annually through my agency. We are part of the continuum of care that covers this section. So I'm going to go ahead and share my screen. Hopefully this works. Share. And there we go. Okay. So hopefully this works, because otherwise we were going to have to go old school. What I have done is I've aggregated the data so that you're able to have an opportunity to kind of see what it looks like. And in this particular case, if you go to the second page, unsheltered count statewide, they counted unsheltered 98 individuals on that one day. Now this is all across the state of Wyoming, right? If you go into the second column, you'll notice that 51 of those unsheltered individuals were actually in our county. So we accounted for almost 51% of the entire count of unsheltered individuals. That's an interesting thought right in and of itself, right? So the count occurs on January 25th. So it's in one of the coldest times of the year. This particular state, having done a point in time count since its inception in 2005, this is a particularly difficult state to do point in time count in because of the weather. However, we do manage to navigate it. And Casper has a very robust group of individuals that are very dedicated to the effort, which is different than other parts of the state. Many of you participated as volunteers. City employees participated as volunteers. We had volunteers across the network looking for individuals. We covered sheltered, unsheltered, and unstably housed individuals. The locations where the people were found that were on street were in vehicles, abandoned structures, uninhabitable and unsanitary locations, things like sheds, things like pipes and underground kind of dwellings, if you will. The gender split was about 60-40 men, women. And chronic homelessness was at 22 individuals, 44% of the actual count, which I think is very interesting as well. When you look at the statewide against the other, there's some additional data set indicators that are a part of that we break down. And one of them is looking at PSH units. How many of those individuals actually need to go into PSH? So of the individuals that the 44%, 23 of those are chronically homeless and need PSH. There is no other option for them. They cannot manage housing independently. We do not have those PSH units. So we're already at a deficit. Targeted outreach in Natrona County is fairly robust throughout the year. We have structured outreach and we have unstructured outreach. So we do well there, and the data set indicators put that into the plan. In addition, one of the things which is a statewide issue is veteran homelessness. However, when we look at it from the most localized point, There are no HVRP grants in the state of Wyoming currently. These are homeless veteran reintegration programs. This grant is incredibly important in mobilizing and being a catalyst around veteran employment and taking homeless veterans into stabilization. So not having a grant like that, it was given away by another entity, has really impeded veteran homelessness, which was actually reducing, according to the AHAR in December. Mental health and substance use services, we do have them, but they need to be integrated with housing or else they don't work, because you have to have a continuous application and it has to be titrated. We see an overrepresentation of indigenous populations as well as persons of color. And then some of the aspects of that we need to look at. And how are our strategies effective? How are we working with tribal entities? Also, youth and family homelessness interventions are different than for single individuals. And that is not something that's of significance right now. So if you go to the next slide. This is a little bit more specific to Natrona County. So overall, we had 167 individuals that were experiencing homelessness that we counted, of varying degrees. When we look at these individuals, we're looking at where they primarily concentrated, primarily in the city of Casper. Once again, 44% chronic, meeting the chronically homeless definition. This is when you have had an extended period of homelessness within 1 year or repeated within a 3-year period of time. Among those chronically homeless, 47% report a disability. A disability makes it even harder to navigate systems. In addition, it's not just mental health or substance abuse. We're looking at individuals who were, when they were surveyed, disclosed cancer, cardiac issues, overwhelming diabetes. So this is a primary medical condition that also impedes an ability for someone to establish certain levels of independence. And most, let's say 24%, this blew my mind, required adaptive equipment for mobility. And I know that the mission has brought this to you before because they've had an increase in people who are in wheelchairs in the last 2 years. The average age group spectrum is 35 to 64. But what really bothers me most about that particular age spectrum is that 20% were over 55 and this is their first time of being homeless, which aligns with the data that we have seen for the last 2 years, which is the senior population is growing in the homeless community. They grow among the vehicular homeless, by the way. So this is oftentimes parking. This is what's interesting. They park in or near a family member's dwelling. They just can't stay with them because then it would not meet the threshold. Somebody could lose their voucher because too many people in the household, lease violations, things like that. And again, the racial disparities that persist. So I do a lot of work and reading in this space, and Ian DeYoung is one of the experts that has been a consultant for many years on homelessness strategies and evidence-based practices. He comes out of Canada. However, he does a majority of his consulting in the United States. And one of the things that's really important about his strategies is it's about switching the mindset from managing homelessness to actually solving components of homelessness, which is where we have to shift our purposes and our actions. One of the most productive ways and one of the ways that we get the most information in surveying is through navigation centers. Locally, you would interpret that as kind grounds. It is a strategy and a practice nationwide that has been expanded and utilized. It is a classification in HUD that says that this is the way that you can get to the street homeless component and move them through the continuum into rapid rehousing. And it is the most efficient model because it comes from a multidisciplinary approach. It's not just on one person, right? And you're not asking people to bounce around to services over and over and over again and try to find them within systems too, because they have a place to land on a regular basis. Navigation centers also improve access to hygiene, primary care. There's a part of basic life needs that can be done within a navigation center that then people do not have to do on public display. In addition, it's regular, it's consistent, and it's reliable. So that at least 5 days a week, there is a space dedicated for providers to focus on and for people to be in order to work through consistent barriers. You don't work through them in 15 minutes in a case management appointment. You don't work through them in 3 days. There are so many different elements that have to be taken into consideration. And then at the same time, look at what someone has the capacity to process. Paperwork, understanding what their responsibilities are, navigating through whether they're nutritionally even able to hear you. Because one of the things that also has been growing and came in the point in time now is the depth of food insufficiency.
Kelly, is Kind Grounds considered a navigation center?
It is somewhat. So if I were to tell you that its goal is that, according to the oversight, I think Dan speaks to that better than I could, but that was the concept that we originally embraced.
Correct.
And I think that its limitations at present compromise the efficacy of being a robust navigation center. I think that would be fair. So some of the, I want to go back to the one slide up here I think we missed, and I want to get to it because I'm sure that I didn't. No. Okay. So some of the recommended strategies that we got and vetted with consulting was that the navigation center premise needs to be expanded and enhanced. 3 days for a few hours is not enough. It's equivalent to respite, perhaps, and respite is a component of a navigation center, but it cannot be the exclusive one. And you can't do enough work in that time frame with the number of people that attend. I happen to work nearby. My staff goes there first thing in the morning on Monday, Wednesday, Friday, which is the days that they operate, to do outreach and to follow up with their case managed clients. They also go back closer to a lunch period because the clock for homeless individuals is different, and street homeless report very early. Those that have been discharged from mercy services from the mission tend to come in later. They still need services. So my staff is doing dual duty there, trying to do that. One of the other aspects is looking at deploying a mobile hygiene unit. For those of you who do not know, there is nowhere, no supportive showering resources in this community. They are all shut down. We cannot buy access. And that is a difficult piece for people. It takes away so much. It impedes health. And do you know something that I don't know?
Well, I'm asking if there was the YMCA, they
It's
used
not an
to allow
option.
that and not anymore.
No. There was an incident with individuals from another organization that shut that down. And so at this point in time, there isn't anything like that. I have experience from a previous employer where during COVID, I bought 2 shower laundry trailers. They're incredibly effective. They're a good resource. They can be parked in spaces that can be combined with other types of outreach and allow people to do the health issues that they need to do without imposing on public display. I mean, I have to look at that and say that's part of the issue. You know, if you don't have any place to do it, you're going to do it because there are certain functions that the body has to do. You can't go get a job if you don't look good. as a person, there's a certain dehumanizing component once I degrade physically, and then I begin to decompensate. And all of those factors cause me to regress. I'm not going to be able to go get a job. I'm not going to be able to go get an employment. Even that's what everybody wants me to be doing. And that's in the best of scenarios. Expanding permanent supportive housing development and rapid rehousing, I know that that's preaching to the choir, but it is important to restate. We have a need for a level of units. Earlier in the presentation, I talked about the fact that 23 individuals, that was the best that they would do in housing, is permanent supportive housing, which means not just housing, but someone who's going to deliver supportive services to make sure that they stay stable, right? I have on a list, the coordinated entry list in office, which some of these people who were counted during point in time count wound up doing their coordinated entry and getting on that list saying, yes, I want to be housed. The average score right now is almost a 12. Permanent supportive housing threshold is 9. I have 14s, 16s. I even have a 21, which in my, have been doing this work for 30 years come October. I have never seen a 21. Never. And it was, I mean, we rescored it twice to make sure we were right. This is a high threshold. This is a community member, though, who needs to be housed. It is really important that services are embedded in housing. So the social determinants of health indicate to us that health and housing go hand in hand. If I am housed, I have a better chance of becoming healthy, which means I have a better chance of not costing my community more in many different ways. That's like the least way I can say it. And it's easier to deliver it when it's connected to housing. Lastly, I'm a firm believer in using data to drive equitable approaches. And what I mean by that is accessible approaches. What is about, it's not just about looking at disparities and ethnicities and things like that. It is about access. If you look back for people with disabilities, the sheer number of them, this community is not particularly ADA. It is very difficult to navigate physically in a wheelchair. Just opening doors in grandfathered buildings that aren't required to have certain kinds of ADA accessible handles, that's a difficulty. So it's a further barrier when you are working from this part of. I look at it as a call to action. This is my job. This is my passion. This is my belief. I think that if you utilize evidence-based solutions and things that can be replicated, we can make change happen. But we have to be committed to it, and we have to be looking at it from a point of strengths. Where do people who are homeless have strengths? They have survival skills that you and I have not had to deploy. So how do we capitalize on those strengths and help them reorganize that, reintegrate it into other ways of approaching life? How do we look at incremental change and build on incremental change instead of expecting wide change too quickly that cannot be sustained? And looking at how to be cost effective in building and maintaining it. I think by improving some of these and diversifying sheltering is critical. It's the way of looking at reducing the strain on emergency services. Right now, there's a lot of overuse and misuse of emergency services simply because we're not doing anything about a homelessness issue. We expect that it will just go somewhere else. Majority of individuals, Casper is the place where people are discharged from more than anywhere else for reentry, for state hospital, because there are healthcare services and there are justice services here. It is not to be punitive to Casper. It's because there are only 2 communities in the state that even have enough robust services to address its citizens that are being discharged. So when you look at that, you're going to deal with it one way or another. So you can either decide to accept that it needs to be solved, because you're not going to be able to put them on a bus and ship them out. They're from here, the majority. They went to high school with people. They have family here. Also looking at sheltering from a continuum rather than looking at a one solution model, I think is unfair. I think if you look at looking at one shelter and thinking that it's the only way to do this is a burden on that provider, as well as an unrealistic expectation. All of us look for choice in our lives. These individuals look for choice too. And sometimes when they have choice, there is an ability to engage at a higher level than without choice. When we look at them and say, you only do this or you don't get, that's being punitive. They just don't have the income. The other part, lastly, is enhancing community well-being by looking at addressing the root causes, which is lack of affordable housing, poverty, and employment that allows people to sustain housing. Because the average cost right now, median cost for a rental is $937 in this community. You're not going to do that on a fixed income, which is exactly why your senior community is becoming homeless. Social Security is not going to cut it. And family oftentimes has already left. So I see this as an incredible opportunity to look at what the data told us. We've had data trending for 2 years now. This is consistent. We are growing at 11% per year since I came here in 2022. So when I look at that and I see these factors, my interpretation of the data, and which it is pretty consistent with other outside parameters and analysis, and some of the consultants that we have talked to, we have to start getting into an action phase, not a talking phase, in order to get movement. Or next year, I'll be before you again, and I will have more dire numbers. My fear is that that's going to start being in loss of life, limbs, and impacts to children. Because if you don't deal with the adults now, you will have another generation of homeless children that will have grown.
Can I ask a quick question?
Sure.
So to your point about you kind of touched briefly on this, and it's been a year since I've worked at the healthcare for the homeless. Do you know if anybody in the community, I don't know if you guys are providing some type of mental health care and substance abuse care in the sense that is attainable and accessible, that they're looking at it from a standpoint that it's either doesn't cost them anything for mental health care, because I know people in the community are charging, some people, and this is not a jab at people to doing this, it's their private business, but paying up to $200 an hour for mental health care. And so to me,
With a waiting list.
With a waiting list, are we providing mental health care to this population? Because we know that a huge portion of this, from what I saw last year working with at Healthcare for the Homeless, they have chronic traumatic stress, substance abuse, which is related to abuse and domestic violence. We have TBIs. There's addictions. So we see this happening. My question is who in the community are we looking at trying to do some type of mental health access like we were doing last year with at Healthcare for the Homeless?
So I think there's a couple of different ways I can answer that question. First of all, I think that there has been a significant increase in collaborative work. I think that between CWCC, Kind Grounds, we are talking about communities of recovery in order to do that wraparound model. I think that is an incredibly strong opportunity to deploy what you're describing. I think that by relocating the Healthcare for the Homeless onto the CWCC campus, which Community Action will also be doing, puts us all under the same roof. So we have a bit of opportunity to do faster integration and case management. I think that's all part of it. But I also think that we have seen a different level of engagement at more administrative tables. I think the trust has done well in the Safety and Justice Coalition is being able to have the behavioral health group to start looking at data, to be looking at action, and how to remove those administrative barriers that somehow don't let our staff do their work. It oftentimes so much of the administrative stuff is bogging down what needs to be deployed at the direct service level. And I think that there's some work in that space that helps.
Well, I appreciate it. No, exactly what I was wondering. Thank you so much.
You're welcome.
Anybody else? I'm sorry, I didn't mean to hog that part of it. Okay, thank you.
All right.
That it?
Hey, that's my presentation. If you have any questions or anything else, I'm very happy.
Yeah, I'll open it up. Yeah, Jenna.
I'm kind of curious on how much, you talk about like those portable or mobile showers or bathroom use. So what is like the cost? What does that look like?
So a capital expense on that is between, depending on the model that you use, and during COVID, it was a little bit more premium, let's put it that way. But it's between, you can get a sizable unit between 65 and 85,000. That may seem like a chunk, but actually when you look at the capacity that it can house, because we're talking about the ones I bought, could shower 3 individuals at a time plus do laundry. So it allows a pretty fast rotation. They're lightweight and very efficient so that you don't need huge trucks to pull them, which is really important because you want to be able to get them into spaces. One of the ones that I deployed went to an urban campground that was addressing 72 households, and it just was a regular process. So they're very helpful. We looked originally into some of the ones that the fire service and things like that use, but they don't do what is necessary for more intimate work. My biggest concern is that, and the reason that I'm feeling very strongly about this particular option at the moment is it then doesn't put it all on one provider to have to manage the resource. Also, it is something that it can be used in many parts of the community instead of just one location. Going to the Y is one location, and that's a burden because the Y is there for many other reasons, right? This becomes a little bit more unique to the service. It will reduce down the need for agencies to pay for laundry vouchers, which may or may not get utilized properly. There's a lot of different things. And then the healthcare component, skin conditions, MRSA, especially during the summertime, if you have an insect bite that winds up getting infected, and then you wind up having to go to the ER and don't have enough income for that, or you don't have insurance, that's a cost that we're all going to share in. And could see some very severe consequences to that. And unfortunately, that's what is happening right now.
Pat, did I see your hand up?
Yeah.
Okay, I'll go to Pat and then you. Is that okay, Mike? Okay, go ahead, Pat.
Thanks, Mayor. So what few meetings I've been involved in, it really is centered. I think the Health Trust has been remarkably helpful in the collaboration process. You have different thoughts on that?
No, I think that's from the day I came into this community and the SIM was being deployed to where the trust and the Safety and Justice Group is at today is quite remarkable. And you're talking a little over 36 months. And you have subcommittees that have had actionable work and outcomes. I feel very strongly about that. However, I believe that we could go further. I think that it's great to have flexible funding and supportive service funding. That is absolutely critical to my organization. However, I would love to see more capital granting or at least one opportunity at capital granting for something like the mobile shower unit, because that is what will be a good investment of those funds. So, I mean, there's all kinds of areas that we can expand, and I think that we'll be revisiting that this fall.
Michael.
Thank you. Kelly, on the mobile unit that you talked about, what does that look like in terms of, I know there's the capital outlay for the unit itself, but what does that look like in terms of like manpower to operate? Is it like a driver, and is there other supervision kind of things required, or?
Operationally, for my organization, I already have the staff that are doing similar jobs. So to them, it actually brings an efficiency piece to what they're already doing.
Sure.
For those of you who may or may not know, I also have a mobile health clinic. So I have a primary health clinic that is a mobile unit that has all the bells and whistles on it, right? I have staff that are already dedicated to that as well. It's a great combination of opportunity to do services in some of the most perhaps transportation challenged areas of our community.
I don't want to get into this now, but if you get a chance, let's talk tomorrow at the coalition meeting. There's a community partner who mentioned some interest in maybe helping support a similar type of endeavor, so we could talk more about that tomorrow. Yeah, thank you.
I will vouch, as many of you know, I did work a time as a therapist for healthcare for the homeless. I'm going to vouch for that team that does the medical work and going into the community to do that is something that is needed, something that could even grow more, I think, that we need that out in the community. So they do a great job of going out into the community doing that too.
We're increasing, we have, just so you know, we also have residents that are specific and seeking training in servicing homeless populations. So from Wyoming Family Practice and University of Wyoming, we actually are hoping that Wyoming Family Practice got the street medicine grant, because if they did, then we will be able to deploy even further. Wound care would be a huge ability for us and would probably save your emergency room a great deal of money.
Pat, oh, excuse me, Kyle, no, I'll give you Pat.
I got a couple, so you can hit that.
Okay, go ahead, Pat.
Yeah, I've got a couple.
Look, you two, quit fighting over who's going to say more.
So, so in the nonprofits off the fifth cent, which we get criticized about, are some of those grant requests come from any of participating?
Yeah.
I'm one of them. Without it, it makes a huge difference. It also, just so you know, part of our proposal is the data integrity and compliance officer who puts some of this data together for you.
So there is some common elements.
Yeah, but I will say that in this last cycle, we had to cut back on that. I mean, it was a big conversation with the nonprofits, and we had to really look at that because Carter had made some recommendations just because of obviously the budget crunches, and I mean even to the point of I think it's property taxes and all those things. This is all going to compound and affect this. And so when we look at those things, this is the reality of it, and it did. The cuts we affected the nonprofits because we did significant cuts, didn't we, Carter?
Yeah, I'd say so.
Kyle.
Thanks, Mayor. And thanks, Kelly, for the presentation. I apologize for my crazy eyes. I'm not possessed. Just got some lingering symptoms, I think.
I just figured it was a long night.
Oh, yeah, not that long. I can't stay up that late. Couple questions for you.
Sure.
You mentioned the first part of your presentation, 98 homeless individuals during the point in time counts across the state. My understanding is that only 6 of our 23 counties participated in the point in time count. So how good do you feel about that number, or is it likely to be much higher than that?
I feel that it is severely underrepresented. Most of the counties do not invest. In fact, I will I will state that none of the other counties put as much energy into this as we do. I think that it is a challenge to them to understand why it's important. When they do understand why it's important, there is nobody that funds this work, right? You don't get money to conduct the point in time count. You have to plan on how you integrate that with your work you already do. And I think that that is something that some of them are starting to look at and build some bandwidth with, but they're not there yet. I think it's a community issue, which is why I asked the community to participate. I want your participation because I want you to tell me what's happening out there, not me orchestrate it. And when people are out in the field and do the count on the behalf of the community, there's a different way of how they bring that information back. Also, just so you know, the street homeless, when they see people out there that they don't normally engage with, there is a piece of that that says you matter. I took time for this, and that's not something that they typically see.
Thank you. It's sounding like, Carter, I don't know if you would agree, but to me, we just had our WAM convention, Wyoming Association of Municipalities down in Cheyenne 2 weeks ago. Probably where I picked up all this fun stuff, but
Probably.
it sounds like it would be really beneficial to maybe have a breakout session tied to point in time count. Like I'd love to hear you or someone else qualified present to the other 98 municipalities about the importance of the point in time count, maybe give some strategies, implementation, pass along some resources. So I personally, maybe in our next board meeting, will advocate that we have you or someone else lead one of those sessions, because I agree, the burden would be too great to have you or Kim at Housing Authority or whoever shoulder the burden for the whole state, but I do think we need to be more assertive and encouraging of the other counties to participate. So not only that we have better numbers, but also just making sure that we get the resources that we need to start mitigating this issue on a meaningful level. So I don't know if you'd be interested in that, but.
I particularly am, but I will also tell you that from a qualified point of view, the Department of HUD actually showcased the city of Casper and Natrona County for their efforts in how they do their point in time count. And that went out in the national newsletter. We, our pictures and all. So how we're doing it is the way that it is prescribed to be done for communities, and it fits the dynamic of the community, which that's the key. The community dynamic, you need to be able to take that into consideration in how you will count. And to count with consistency over time so that you can look at your trends, and to not just count unsheltered, but to always count sheltered and unstably housed. Because if you don't take care of what's happening upstream, you're going to have a bigger problem downstream.
Thank you. Maybe Mark, our regional director at HUD, would be another good person to reach out to. So,
We work together frequently.
Perfect. Well, I will take that with my colleagues' blessings. I'll take that as something to recommend in our next board meeting.
Yeah, you bet.
Thank you. So your presentation, I think, outlined lots of opportunities that I think stakeholders in our homelessness coalition, which is meeting tomorrow, gives them some sort of goals to work towards and maybe some collaborative strategies that we could deploy through that group. I'm curious, from your perspective, what role does the city as an organization have in achieving some of these recommendations? For instance, is there anything, your insight you might be able to provide us that the city can do to incentivize development of truly affordable housing? That's something I've been spinning my wheels on, is what can the city do to incentivize that? I don't see much in the way of tools, so would love to, if you have anything, would love to take it.
I think that there is an awful lot of effort that has gone on in this community and at the community level. Pat, Councilperson Sweeney indicated about the Housing Committee at the Trust, we have invested a great deal of time in investigating models and opportunities, cost-effective housing developments. I know that there are conversations occurring. What I do think is that in reference to that meeting tomorrow, is really getting down into doing an actionable set of goals and breaking them down with some targeted tasks. I feel like we've spent a lot of time surveying the landscape and, you know, kind of looking at what is. Now it's time to do something about it. And I think that the city can be a champion in that. I think the city also has an opportunity. I'd like to see the city be engaged in a little bit more of the, and I would say this to any entity, so not just the city, but to say that I would like to see them more engaged in the collaborations that occur in those housing committee meetings, because there's opportunity. If it were not for Ms. Becker and some of the efforts that she puts forward, some of the efforts of the trust and those nonprofits and organizations that are part of that housing committee, you know, we're going to keep trying until we make it. And Melissa Noah at WHN and I are very much in alignment because I'm an expert on the supportive services side of permanent supportive housing. She's the expert on development. And I've done development, but she's better. So I would rather work in concert with that type of group, and I think that the city has a place to be in that game.
Thank you.
Yeah, go ahead.
Maybe the answer is similar to this question, but I know in a lot of the conversations I have, Pat and I and Jenna actually were at a joint meeting last night between Old Yellowstone District, Downtown Development Authority, and Downtown Casper Business Association. Obviously, the folks downtown that own property and businesses interact, you know, have lots of engagement with folks experiencing homelessness and stuff. And in my conversations with them, there's oftentimes a lot of trepidation or hesitation towards building out services in Casper. The phrase, you know, if you build it, they will come, gets used pretty often. And there's a fear, I think, of Casper becoming an oasis kind of homeless resources in the state. What do you have any recommendations for us? It's my belief that we should be advocating for a statewide solution of some kind. And I know there's interim committees working on housing related issues in the legislature, but I share some of the concern of these property owners in regards to Casper not getting so ahead of the curve that everyone else just sort of feels like they don't need to develop resources because we're just going to shuttle everyone to Casper. So what can we be advocating for on a statewide level to make sure that the building out of these services, while Casper maybe can take the lead, it's being done kind of uniformly across the state and that Casper's not kind of going at it on its own? Is that coherent? Sorry.
Yes, first and foremost, state of Wyoming needs a Department of Housing. It is the only state in 50 states that does not have one. Without having that entity, first of all, you do not have a portal for a lot of funding and other mechanisms to flow through to entities that could capitalize on it, right? And if there is ever some incentives, and you know, we're going through a very precarious time and not knowing what federal budgets and things like that are like, right? But at the same time, we have to be looking for the opportunity. And if you read those federal budgets as they're being proposed right now, LIHTC is going to be one of the biggest beneficiaries. LIHTC is an investment in housing. There's no portal though to teach people how to do it. And so if you don't have a Department of Housing at that highest level, the lower levels are always going to suffer. So that's part of it. I'm a business woman. I have employees. I have a building that I don't want to have harmed either. I understand the difficulties of employers and businesses that feel impacted by people doing behaviors in public that should not be done in public. I get it. It's a public health hazard sometimes. But then if that's the case, the idea isn't to say, don't give them anything. Because it's not about what you're giving them, it's about where it is and where and how accessible it is. Don't, you know, no one seems to, and I don't mean, I'm not flippant this way because I have high regard for the mission, but you have to remember it's not too far off of downtown. But no one questions that. And I think that that's really important. We have to look at establishing entities that can deal and actually are trained to, and their scope is dedicated to that. I came from a community where we worked with the city to develop a somewhat of a first responsiveness type of thing for downtown merchants. We developed a brochure. We educated on the code of what you can and cannot do in public spaces. And then when they had an encounter, I was one of 3 agencies that said, my staff, you call, we will come. And we will go and we will do attempt intervention. We did that because we believed in our downtown merchants too. We want them to have viable businesses. We want a healthy community. I want a healthy community. I love this place. I've been here for 3 years. Best move I ever made in my life. I am passionate about contributing because it has given me so much. And so with that in mind, how we deal with those components is we start creating better relationships and not see each other as against each other and at cross purposes, but how to look at it, how to utilize each other better.
I just wondered if Dan O'Dell had anything to add, or Kind Grounds, if they found a location.
Yeah, you bet, Dan.
I don't have a whole lot to add. We do want to expand Kind Grounds. We want to become more of a navigation center in the truest sense. We'd love to be open 7 days a week. You know, it's funding that's holding us back. Kyle, I'm going to take it as Councilor Gamma. I'm going to take it as a personal quest to come up with an answer for those folks who say, if you build it, they will come. Because for me, when I see unhoused people, you know, I'm not just seeing somebody who needs to get a job or somebody who doesn't fit into society. You know, I imagine that they're in this place because they have experienced an incredible amount of trauma. Or they have had a severe brain injury, or they've had, because I've heard the stories. I mean, we fixed a bike this week from a young man. He's an Iraqi war veteran, and his PTSD is so bad, he can't sleep inside. So he is constantly on the move. And so I think changing the mindset, if there's anything I would add, I want to work on changing people's mindsets that these folks are our neighbors. We have to start seeing them as our neighbors, and they're socioeconomic refugees.
Yeah.
Well, I was just one thing that I didn't, and it is a cost factor that I think is important. Individuals who live on the street die 30 years young, have less of a 30-year lifespan than the rest of us. Okay? Which means they encounter chronic elements. So, and trauma, just being on the street, in and of itself, no substance, no nothing else, is a traumatic experience. Layer upon layer upon layer. Oftentimes there is this narrative that says that substance put me on the street. Essentially, substance is what helped me cope for being on the street. Drinking helped me stay warm. Abuse helped me navigate feelings and fears, artificially, of course. And I think that we have to start looking at that differently, because you know, when you have a family member or someone that you see on the street that you went to high school with who looks a lot older than you do, and then you read about it in the obituaries. That's hard stuff and it comes home. And unfortunately, I've had those experiences in my life, and I don't want to see that for anyone else.
Take one more comment because of interest of time. Somebody else. Kyle, did you have some?
Yeah, I just wanted to appreciate you both for speaking tonight, appreciate the passion. You both speak about this issue. I think you both are very saint-like in your approach. We are very grateful that you call this place home. Dan, for folks that might want to contribute to the cause, I'm sure Kelly at CAP, you know, you guys always accept donations. You still selling coffee? Metro still have a Kind Grounds
Heck, yeah.
brand? Where can someone pick that up?
Again, can you come up to the podium? There's a microphone.
Oh,
Please
so they
do.
can hear you.
oh,
Sorry
sorry.
about that.
Yeah, and I'll sell you a Duck Derby ticket too.
Oh, yeah.
But,
Love to be in the
while we're at
ambassador.
it, yeah, if we do have some bags of coffee left, we sold about $1,400 worth at the Nick Fest. Shout out to the Nick Fest folks. But yeah, if somebody would like to support Kind Grounds, you can go on the website, kindgrounds.org. And if you do a $20 donation, we'll get you a bag of coffee. Just make a little notation of that. I'll deliver it. So
Right, you heard it here. Metro roasted even, so.
that's right.
Thanks, Dan.
Dan, appreciate it.
Thank you all.
Thanks, Kelly. Appreciate it. Appreciate you. So we're going to swap the Holiday Square and Fort Wyoming Center pro forma due to get the decision at a reasonable time. Okay. Carter, do you want to prep us for Fort Wyoming Center?
Yes, absolutely. Council requested, very appropriately so, to have an analysis that we can turn to over time and so forth as it relates to the performance of the Fort Wyoming Center, and I would say more broadly the fund as a whole, pertaining to the fairly unique item of the net operating loss component. So council can see over time how the performance of the Fort Wyoming Center Fund does with respect to trying to manage that subsidy and investment, and against the goal of breaking even someday, and hopefully eventually not having a net operating loss that the city and the general fund would cover pursuant to this operation. So with that, we have a model that we would like to go through with you that has some unique character to it that, you know, hopefully will feel comfortable wrapping your head around, given that it is a little different than both the pro forma models that you see on the utility side as well as the pro forma models that you see on the enterprise side, because this is different than both of those. Although they look really similar when you look at it from a 30,000 foot perspective. I would say, just to kind of very briefly orient the dynamic here a little bit as it relates to the Fort Wyoming Center, and then we can have Zulima talk in a little more detail here. The green line at the very bottom is where, in fact, the Fort Wyoming Center actually makes money. And so you have to kind of inverse yourself a little bit pertaining to the models that you're used to seeing. We want that blue line to actually hit that green line, so that indeed you can say, okay, that's the point where we are not making money, or making money and not having a subsidy investment here. In fact, the most ideal thing would be to have that black line hitting that green line, because the black line is where we are acting, if you will, from a fund entirety perspective, to the point of not having to take on subsidies and investments from the general fund. So that's why I said at the very beginning, you got to kind of train your mind a little bit differently in looking at this pro forma, because the fact is, we need to hit that green line in order to demonstrate the optimal operating condition. At the bottom of your screen here, we want that black line and blue line to be commingling with the green line. And that's where you find nirvana, if you will, as it relates to the operation of the Ford Wyoming Center. Conversely, conversely, if you look towards the left-hand side of this demonstration, where the cursor is, thank you. That is not ideal operating condition. You see that peak kind of rising above the red line there. That is a demonstration of going the wrong way. We're losing money and we're taking on subsidy way more than we ever should have or do or have, I should say. And to be candid and fair, that is at the time that we brought OVG, at the time was called Spectra, into the mix as our partner in operations of the Casper Event Center, which is what it was called way back when.
That was when we brought them on, or we brought them on in response to that situation?
We brought them on in response to, if I may, Mr.
No,
Mayor,
please, yeah.
brought them on in response to the dotted line situation. The period of transition kind of set our world upside down a little bit. And then we leveled out as Spectra and OVG kind of came into the mix and started normalizing what we're seeing here. The trajectory from that point to now is actually quite positive, albeit I hope that we can see the relationship here improve over the next year. We can do better than that, is what I'm saying. And I think with the new leadership that we have over there, you will see that happening here over the next, 6 to 12 to 18 months. We want to migrate away from that red line, and I'd like to see that sooner than the end of the budget year if we can, so that we can start getting to that more optimal and ideal performance level towards the green line there. What I think we should consider as we move forward with this model, sort of mapping our course, would be that of trying to set financial goals, capital benchmarks, and those kinds of things that you are used to seeing in the utility pro formas and so forth with this model as well, so that you can start mapping a course for a more appropriate trajectory with the appropriate goals in mind, and those goals being demonstrated on this exhibit, if you will, as well. Again, just remember, wrap your heads around the notion that it goes in a different direction in this particular exhibit.
When was the new seating done and redone? Was that in 17?
The new seating was redone in 2018, which was very memorable for me because that was like my first year on the job. Very controversial project. The initial run at improving the seating took place probably 16, 15, somewhere around there, with consensus funding, if you'll recall.
I had the pleasure of being a part of that too.
So, Mayor, was that also the part of the the big pyramid there?
Mr. Mayor, Council, I would say probably not, because that was sort of an offline capital project that Council was willing to take on to make the seating where it is today. So I would not build that perspective into what you're seeing here on the pro forma.
Lima.
So, Mr. Mayor, if I could,
Please,
I'd
yeah.
love to have Zelima add some color to this that I may have missed, as well as the team from the Ford Wyoming Center. Thanks for being here.
Mayor, Council, good evening. Thanks for having us. So a couple of things that I want to just add on to what the city manager shared. So just to give you an idea, so this dotted line indicates, well, it was net operating loss benchmark. And that benchmark was established as the average of the loss that we, the city of Casper, as the operator, experienced in the 3 years prior to our transition to Spectra. So on average, we were just under $1 million in loss. And so we brought Spectra on, and that net operating benchmark was established at that point. As the city manager indicated, the transition years were a little challenging, but we have since corrected. And of course, weirdness with COVID and the pandemic. But I want to make sure that you all understood this period of time, it was operated by the city of Casper. Spectra took over, and the operating benchmark has remained the same over the last 10 years. We have not changed it, despite the fact that inflation has been high and expenses have continued to increase. We're managing to perform down in terms of loss, which I think is really exciting and a tribute to the work that our operators doing. Another thing that I want to just point out, and of course this was in your memo, but to me, this is a pretty good return on investment. If you consider that we're investing just under $1 million a year in the operation of this facility for over a $25 million return in economic benefit to our community. And I think that's really important to emphasize. Because yes, we are contributing funds to operate the facility at a loss, but what it's doing for our community, I think is really important. And why event centers across the United States are owned by municipalities and operate at a loss. So then, you know, in regard to our opportunities moving forward, we really believe that we need to focus our investments on 4 key areas. So we need to be able to increase our food and beverage sales. So investments in concessions and concourse so that we can funnel people to the right places and manage point of sale a little bit easier is important. We need to be able to attract talent, touring acts to come here and ticket them appropriately. We need to be able to increase our rental opportunities. So having people locally or regionally who want to rent the facility for various events. And then the last one, to look at my notes, losing where I'm at. Oh, corporate sponsorship. So of course that becomes a very important part of the revenue portfolio for this facility. And of course, you know that we are currently looking at negotiations for the naming rights for the facility, and that's an exciting time for us. So as the city manager indicated, we had a stellar year in FY24. We do our budgets back in like March, right? So, and June is going to be a standout month between CNFR, Cody Jinks, and Hosier. We will end the fiscal year really strong. But these are conservative estimates for FY25 to finish out the year. And then for FY26, when we established the budget, we didn't really have a large touring act already scheduled. And so this is also a very conservative estimate for what fiscal year 26 looks like. You've probably seen a slew of announcements for content that's coming to the building, which will absolutely improve that. So to Carter's point, we will see FY26 perform better than that. That was just a very conservative budget estimate that was made 3 months ago before some things materialized for us. And with that, I will stop talking and let you ask any questions. And of course, we have Jake, our general manager, and Amanda, the assistant general manager, here to help me answer any questions you may have from a technical standpoint.
Yeah.
So question on the naming rights. So, because I think that's probably a bigger dollar amount. Where does that money go?
Mayor, counselor, so our operator has accounts that they manage for their daily operations. So correct me if I'm wrong, but I believe all the sponsorship, corporate sponsorship revenue, including naming, goes into the operating revenue accounts, and then they use that money to operate the building. And then in addition to that, for the net operating loss, they invoice the city, and then we pay them additional revenue to keep the cash flow going. Does that make sense?
It does.
So they operate just like a normal business would. We have revenues coming in, expenses going out. We just supplement the revenue with the net operating loss payment that we provide them every month.
Other questions for Zulima? Yep.
Can you alluded to it, but can you put a finer point on this model and how it stacks up to other models in similar communities and how they deal with their event spaces or large venues similar to this one?
Sure. So good evening. Thank you for having me. So to answer your question, OVG itself operates over 300 venues across the nation and the world. And so this model is kind of a standardized one in terms of the net operating loss model, in that it is on the city or the municipality to supplement that or to support that. And then the work that we do hopefully drives that net loss down. But then the piece that Zulima brought up is that the economic impact of the operations of the building are one of the larger or key points that can show the benefit of that building and what that operating loss then gives back to that community.
So you wouldn't characterize it as unusual for the city to be contributing this money annually to a venue of this type?
Oh, absolutely not. No, most public assembly facilities across the globe operate at a deficit by the municipality. And again, is then balanced by what kind of benefit does that deficit bring back to the community.
Here, may I just add
Yeah,
one
go
quick? So you may recall we did the feasibility study or the expansion feasibility study recently. And in that body of work, the consultant did look at comparable facilities, comparable sized facilities and in communities comparable to Casper. And that reported what the average loss was. So I don't have that number committed to memory, but we can certainly get it to you as a refresher.
That would be, I'm sure I have it also somewhere, but if you get to it before me and want to shoot it over, that would be great.
Carter, did you have something you wanted to say?
Yeah, in case I missed it, if I may build on that question that Councilor Pollack had here. In your experience, Dan, and perhaps even in OVG's network, what is the percentage of municipally owned buildings or government-owned buildings compared to privately owned? Can you give me a feel for that?
I can't say specifically, but in terms of OVG's, our company, the number of venues that we own specifically is less than 20 out of that number.
Out of what number?
Out of 350
Thank you.
venues that we manage across the globe. So it's not a common thing. It's something that, in my opinion, in my experience, is kind of a new trend in our industry.
The new trend being?
Owning the buildings outright by the company rather than being owned by a municipality.
Or somehow held privately?
Correct.
Okay. Thank you.
You bet. Other questions? Yeah, Michael.
Yeah, mine's along the same lines as Councilor Pollack's. And I don't think it was answered, but I just want to make sure. So with the economic benefit to the community, in your experience, is there a model where that subsidy is covered? You know, we hear about that a lot. You know, there's $25 million economic impact to the community or whatever it is, where that benefit is tapped to cover that subsidy rather than the city funds, or is maybe that's the model is the city funds their taxpayer dollars subsidizes that, which supports the economic impact. So.
To my experience, I have not seen a specific model to that in terms of that benefiting the operational funds of the building. I have seen it in terms of any infrastructure or capital expenditure improvements to a building where a TIF district or some other mechanism is used that encompasses that site and others that benefit from that site that then reinvest that money back into said location. But in terms of an operating situation where that money would go into to support the operating funds, I personally have never seen that before. I can reach out to my colleagues within our company and ask and see if that is something that they're seeing in other locations. But me specifically, I have not seen that particular setup.
So just to follow up, if
You
I
bet.
could, TIF district, what is?
Tax increment financing district.
Thank you.
And so I am not a finance person in this sense, but the general understanding is that the identified location or entities that have this increment taxation to it, then that money is put back into a fund that is then redeployed to the benefit of that area so that it continues that redevelopment and the economic benefit just keeps growing and growing.
Thank you.
Any others before we move on? Yep, Kyle.
Thank you, Mayor. Thank you all for joining us this evening. I'm gonna be a little rude and go outside what we were talking about, the pro forma, the timing just lines up perfectly. What more can you shed in regards to light on the fireworks festival this year? So saw lots of commentary. Obviously, things are a little bit different this year. The primary concern seemed to be lack of bathrooms.
Sure.
So do you mind just giving a little bit more insight in regards to why that decision was made? What sort of factors kind of play into that, and provide some additional context if you could?
Sure.
Thank you.
To allay any concerns, there will be porta potties. There will be
Okay.
bathrooms available.
Tommy, where are you at? Got that?
So this conversation was one that happened a number of months ago in preparation for this event. It happened back when we were doing the budgeting process. And one of the trends that we've seen over the past couple of years is the festival portion of the fireworks is not as well attended. The attendance is continually going down and the expenses are going up. And the revenues that are realized from that event do not cover the additional entertainment, the food trucks, and all the other items that are included in that. So in addition, the fireworks themselves, those are getting more expensive as well. And so with the outlook of our budget, seeing that trend in attendance going down and the expectation that those revenues would also probably continue to go down, we thought that it was the most prudent use of the funds to scale back, put on the fireworks display, which is the big thing that everyone is expecting, and still allow people to come and enjoy it at the Ford Wyoming Center. We just would, again, scale things back to make it more economically viable for the community here.
Oh, did you want something?
Just
Yeah,
add one
you
note
bet.
that we actually had conversations about also the fact that the 4th of July is on a Friday this year. And so we actually anticipate that because of things that will be happening at the Speedway, the fact that the Spuds will have a baseball game, all of the lake traffic that is very popular over the 4th, we expect that that will actually detract, just further impacting that downward trend of participation and revenue from that event. And so we felt like the community would be well supported with other activities. And so I approved or agreed with the proposal to scale back to just fireworks this year.
Yeah.
So I totally agree with the comment on, I'm fine with the subsidy. The event center generates, in my opinion, on most of the time, great deal of sales tax within the community. Unfortunately, while some people think it's fortunate, but ticket sales for events, ski passes, those things are exempt from tax. Because I didn't notice a sales tax on tickets I bought for CNFR.
So the sales tax is actually included in the ticket price. So it really depends on the entity that we're working with as to whether or not those tickets are tax exempt or not. If the entity themselves is tax exempt, then there is no tax associated with it. But if they, we do collect that tax and we do remit it to the state regularly. And I would also like to point out that these numbers also do not reflect the change in the tax rate as well. We were able to absorb that by our current budget this year, and we anticipate doing the same thing for next year. That increase or that increase from year to year had nothing to do with that tax portion.
So, but I'm fine with this subsidy. I think it generates a lot of activity for the state in our local economy and our local vendors. And I think our citizens appreciate having the facility in use. I will say since Kyle opened the door, when I was leaving Thursday night, I did notice people were actually parking on the spot that I was talking about. And so I really will make a plea for, and granted that the horse trailers, took a lot of space up where we're expecting additional parking. I will grant that, but I still believe that it's the right thing to do to not include that in the sale of that potential land deal with the BLM. So.
Did you want to respond to that? I know you had said you had something else too.
No, yeah, no.
You don't want to
I
touch
think
that
that's a fair comment.
Okay.
I was giving Mr. Sweeney a hard time with my, recalcitrant response.
You just made that up.
No, it's a word.
My daughter's been recalcitrant for years. It's a real word.
Carter, did you say you had something you
Well,
wanted to say?
since Councilor Gamroth had the opportunity to be rude, do you mind if I carry?
Please. Please do so.
No, it's not really. But I do want to ask a question of you, given your knowledge of the network that OVG oversees and the experience and the insight that provides. What is the reality of a government like ours who may get fed up with trying to provide an investment of, close to $900,000 a year every year and says, we want to just sell this facility and offload ourselves of this issue, and get out of that business altogether. Some would argue the government shouldn't be in this business, so to speak. What would the reality be of us being able to sell to a private owner and present the same economy from here on out, but in private oversight?
That's a really hard question to answer, especially the question of what would the city be willing to sell it for would probably come into question, and I think that number would need to be established. I have never been in that position before. I can definitely ask my colleagues as to what that would look like. In my experience, I have not necessarily seen buildings of this size and caliber be purchased outright very often. So that would definitely be a piece of it. So I'm sorry, I can't really adequately answer your question. I don't have that.
Mr. Mayor, my suggestion would be, you probably can't answer because it probably doesn't happen a lot, would be my guess.
Most privately owned buildings, sorry to interrupt you, most privately owned venues like this would be ones that are built to meet certain specifications. One of the things that these buildings need to have are certain elements that will attract large scale acts. As comparison here at the Ford Wyoming Center, we have certain limitations to attracting larger or more popular acts. And so a lot of those different items would be taken into consideration with that as well.
Well, Mr. Mayor, my suggestion would be if council ever does want to talk about selling the building, I would say, let's sell it at a really, really good price. If indeed you want to get out of this obligation. Even at that, however, even if you sold it at a really, really, really good price, I don't think this investment will be one that will attract a suitor. Because that $25 million does not come back to the property owner. It comes back to the economy overall. The folks that own distilleries, the folks that own hotels, folks that own restaurants. It doesn't come back into the coffers of OVG as far as that economy that's generated.
Yeah, Kyle, we'll do one more and then we'll move on, guys.
I know we're a bit behind schedule, but I thought we'd take advantage of y'all being here because we don't get the opportunity very often. Was stoked to see some of the recent announcements. A lot of people excited about it. There's always naysayers out that say, oh, same old, same old. Since we kind of brought up some of these issues, do you mind? I'm sorry, what was the name again?
Jake.
Jake. Do you have any recent stories of acts that you've tried to book at the venue and, you know, the recent past that you spoke to the limitations? What are the limitations? What are the reasons we're not able to bring some of the acts that maybe people think we're qualified for? Can you just speak in general to what you guys face at the Ford Wyoming Center in recruiting acts?
Sure. Right now, the biggest challenge that we see is actually in the design of the building. So when we talk to tours, they are not only interested in the monetary side of things, they're also interested in the logistics side of things. And so we send them off a tech packet that gives them all of the individual items about the building, you know, what our height is, width, all that fun stuff, including what our weight capacity is for the steel structure above the arena floor. And that's what holds the rigging or the sound, light, and video boards, all that fun equipment. Currently, the truss system at the Ford Wyoming Center is rated to hold only 28,000 pounds of weight. Buildings nowadays of this size are being built with over 100,000 pounds of weight. The most recent location that I came from was a theater in New Hampshire, 750 seats, and that theater was capable of holding over 50,000 pounds of weight.
Wow.
So when you look at that one specific item, when just a month and a half ago, we actually got a confirmation from a musical act that, from my understanding, has been tried to be brought here for 8 years, and they finally confirmed, and then they took a look at our tech packet. And 20 minutes later, they said, sorry, we can't come. We're too heavy for your building. So with that being stated, we're still in communication with that specific tour, trying to see if there's anything that they can cut down from their setup. Some people are like, yeah, we're willing to part with XYZ items. Other people are like, nope, that's part of our whole production. We're not going to part with that. So that one item right now is inhibiting us from being able to bring larger or more popular acts that are touring nowadays. You take a look at some of the other amenities within the building, just the age of the building. There's been some good reinvestment in the building, but it is like your home. At some point in time, you're going to have to replace the boiler or the hot water heater. You're going to have to redo the roof. You're going to have to redo a number of different items. And so this facility was great 43 years ago. Nowadays, we need to start having conversations about what are we going to do for this facility to make sure that it continues bringing the benefit to this community for the next 40 years. Did that answer your question?
It does.
Go ahead. I'll allow it. That's it.
Thank you. So obviously you guys are going to work to maximize efficiencies, bring in high dollar acts that work towards reducing the subsidy, but it almost sounds to me like the infrastructure up there year after year going forward is going to restrict your ability to reduce, you know, the building itself is going to be a major obstacle in achieving kind of cost recovery goals.
Looking at another avenue, food and beverage. So we rely on electricity and then also plumbing. Both those utilities are in older shape. And so right now we do consistently run into issues of not having enough electrical power where we need it, or we don't have the appropriate plumbing in the right locations. And so looking to give a better presentation or better product to the community, we're held back by some of those structural items.
Okay. Thank you.
All right. Zulema, anything you want to wrap up with?
I just want to remind you that despite the challenges that we do have, Council, we have some very exciting things happening in terms of our naming rights, in terms of another 4 years of state championships here at the Ford Wyoming Center, and our negotiations with CNFR to bring them back for a long-term commitment. So yes, we will need to make some investments, and this team will work on our strategy for that. But I think the future is bright if we stay committed to having this venue in our community.
Shape the balance.
Thank you, guys. Appreciate your time. Thank you so much. All right. So our last item that we will go over is the Holiday Square conversation. All right. Carter?
Mr. Mayor, councilors, this is the opportunity to critically evaluate where you would like to see this event go over the next year to 2 years and perhaps longer. In that you requested some analysis pertaining to the cost of putting on this event every year, which admittedly in recent years has become really big, really popular, and it does consume a lot of time and effort and energy, and also I would say with great pride, staff has done really good work in terms of actually generating out of organization money to help support this event. And so it's come a long ways in a lot of ways, which I am super proud of and happy to report. But yes, it is expensive. And yes, to continue it would take funding that could certainly be used elsewhere, particularly in the absence of private sponsorships and donations, should they ever go away, right? Zulema has done a lot of work with her team in terms of trying to really discern and distill what it is that it takes to put this event on every year. And is prepared to ask whatever piercing questions you have with regard to what it is that this analysis might need to include. And so if I could invite Zulema and her team up to be prepared to take those questions. I'd rather her do that than me, frankly.
Hi, Katie.
Kyle's not here to ask those piercing.
Oh, no, we'll just keep going. Don't worry about Kyle. We're just gonna keep moving along. Zulema.
Mayor, so as city manager indicated, this is one of the Parks Division's largest events. I mean, we are a Parks maintenance team, not really well equipped to host events, but Holiday Square is one that we have embraced as a team and taken on for the last several years, and one that Katie's team in particular expends a lot of resources on for sure, but also one that we're very proud to offer to the community. Given the budget cuts this year, the reality is that we lost one of our seasonal employees in our urban forestry work group, which Katie oversees. And so to ensure that critical tree work can still get done despite being down one staffer during the summer, we need to reallocate our full-time resources in the fall to tree work, which is critical to the health and safety of the community. And that means a reduction in the time that our full-time staff is spending in the park applying lighting and other amenities for the Holiday Square celebration. So we calculated out, Katie has done a lot of work really quantifying through our work order system and other mechanisms what our resource allocations are and what the planned redirection of those resources would be. So at this time, our current fiscal year budget, which you just approved last week, did not include eliminating the event altogether. It just included scaling back so that we could reallocate approximately 480 hours to tree work in the fall instead of to Holiday Square. And so that means we would go from lighting 67 trees in 2024 to only lighting about 30 trees this season. Also keeping the larger lighted amenities, including the nativity, the snowman, the Santa and his reindeer, and the mega tree in the middle that's set to music, show trees, as we call them. And so not a complete reduction or elimination, but certainly a reduction so that we could reallocate those resources and complete the essential work that the community needs us to do. That being said, we're prepared to take direction from council if you decide that all of the resources should be reallocated somewhere else and Holiday Square should go away, or we could try harder to obtain private investment to make the event go with contracted labor potentially.
So I think what we'll do is we'll open up the floor for questions, put it into context. And I know they're looking at a direction for tonight. So maybe we can give them a clear direction whether we want to go with recommendation of cutting it down or cutting it completely out or what we want to try to do with it. So I'll just open up the conversation. Yeah, Pat.
So I like the plan. So I thought the medical center honestly started that whole thing I don't know if they sponsored it originally or how that went. And I noticed in the memo that Banner at some point is unwilling to sponsor. So if you could just.
Mayor, Counselor, so I did a lot of research, tried to dig through as much as I could to understand better what the history of the event was at its inception through time. And the best information that I could find was provided in the memo. So the event started in the late 90s. Wyoming Medical Center at the time was a primary sponsor of the event. And we do know from articles that were published in the paper, I believe 2011, 2012, I was able to sort of capture, the year that it first started in the late 1990s. And that at least through that 2011, 2012 year, Wyoming Medical Center had remained an active partner. But in terms of like the exact year that they pulled out and stopped contributing a significant amount of the resources needed to do the event, I don't know. Do you have?
I can't say for sure, but I know it was a year, I believe it was a year before COVID when they completely stopped. They used to have the reindeer relay. And that was the year, that was kind of the final pullout, was the year before COVID. And
Carter said he has a little bit of perspective on that.
If it's okay, I happen to be the guy that was on the receiving end of the phone call the very first time Holiday Square was initiated. And it was then initiated by an employee of the Wyoming Medical Center who committed to going out and collecting donations from businesses around the community, one of which would have been the Wyoming Medical Center way back when. And it was in the late 90s. I was brand new at that time. And they, to their credit, were very successful presenting a presentation to the community that was a fraction of what it is now. It was a few trees, a couple static displays.
11 trees, sounds like.
11 trees, yeah, that doesn't surprise me. But it was driven almost entirely by donations. The city really didn't have to put any money into it at all, with maybe some in-kind help and blessing of the council of the day. So it's come and gone in terms of donations that have been involved and available over the years, to the point where I think now it's about $16,000, if I remember correctly. 18, which is just a fraction of what is needed to continue it to the extent that it is today.
Amber.
Thank you. Can you tell me, I think I have two questions. Can you tell me the proposal here with the scaled back version, does that get us to sort of a net neutral position in terms of the hours in the urban forestry work group that we would have had, should we have had a full staff for that group?
yes, Mayor, Counselor. Yes, that would be exactly what you're saying. It would get us about to where we would be had we had a seasonal this summer to be assisting our arborist. With the lack of that seasonal position, our arborist has unfortunately has not been able to do the amount of tree work, and we have a significant amount of tree work that we need to get done. We have contracted some out. However, there is, as all of you know, there is a great need for our trees to be healthy in our community, taking care of hazardous trees. And so, yeah, there would be some benefit as far as that goes. If you decided to scale back Holiday Square, it would allow some more time in the fall for some of our full-time employees to assist with that. Like I said, there's great need for that.
if you have more to add, that's
Well, I want to reiterate that at one point this year, we felt like we would have a significant boost to our urban forestry program through our Branch Across Casper funding, which of course has since been removed. So, had that grant been able to stay in place, we may have felt like we could absorb it because there was other funding available to do this critical tree work. Now that funding is gone, and so we have no choice but to allocate those resources appropriately to make sure that at least the most important tree work can continue to happen.
Thank you. And you may have already answered this to some extent, but so it looks like it leaves about 480 hours of labor in the budget for this. If we were to say, let's not do anything, would those 480 hours go specifically back into that work group, or would they be spread more broadly across parks, or what would you do with them?
Mayor, Councilor, so primarily the urban forestry and weed and pest group are the ones that do the lighting in the park. The rest of parks assists, for a couple days, I would say, with a few things when we need more hands-on than what we have. However, yes, those hours would go back primarily to urban forestry and weed and pest.
So if we did that, then it would be a net gain in number of hours to focus on addressing trees, not in terms of growing the number of hours that we're paying for, but in terms of allocating to essential tree work.
Mayor, Councilor, so, and I think that that's an excellent point to reiterate. We're not seeing a savings because we will continue to employ our full-time staff, right? We're just redirecting those resources to other critical work. And so, the reduction came from eliminating a seasonal position during the summertime. We will still have the cost of the full-time staff. It's just a matter of how we're prioritizing.
You bet.
Thank you. So I guess at that point, I think my concern is satisfied with this proposal, but I would also support the department if your recommendation was that it's more important that we deal with the backlog of tree work that needs to be done. If it's we're kind of at a budget neutral position now, which is, I think, an appropriate recommendation, but I also think like this is a type of thing that we should be considering when we don't have the luxury of being able to bring on additional part-time staff to say like, this is what the work needs to be done, so we need to staff accordingly. When that's not an option, to me, I would absolutely support the department in saying like, we have more important things to spend our time doing, and this is what that is. So from my standpoint, I would defer to you, but I know that may be something that you wouldn't want to bring to us because it's a difficult community conversation to have, and it's possibly a difficult department conversation to have, since it is something that I think people enjoy and they want to work on and the community loves and all of those things. But I would certainly support the direction that you all proposed as the most critical use of those hours.
Mayor, Councilor. So thank you for that. I appreciate it. I would offer that, assuming the direction from council is not to completely eliminate the event, there would likely be a hybrid because staff is prepared to go out and make a lot of asks. So we believe that while we felt like we were wildly successful last year in raising $18,000, we do believe that we have an opportunity potentially to raise more because of how much people in the community love going by Conwell or the Healing Park at Conwell and seeing all the lights in the park. And so I think there's an opportunity for us to bolster that private investment and maybe still take some of the work off if we were able to use those funds to hire local companies to help with the hanging of the lights. I do foresee an opportunity for there to be sort of a hybrid where our hours can still be reduced without increasing any expense or resources from the city.
Thank you, Mayor. And thank you, ladies, for the presentation. Want to make sure I'm reading the memo right. So this kind of proposal for more limited lighting, it looks like everything stays the same except for the number of trees. We're going from 67 to 30 lit trees, but otherwise the mega tree, the nativity scene, the Santa, the reindeer, the snowman, So it's just essentially half the trees, right?
Mayor, counselors. Yeah, and one thing I wanted to mention was the idea would be when we reduce, if we were to reduce to 30 trees, the trees that would be lit, they're in the northeast, primarily the northeast to central part of the park, because that is the corner where our program trees can go. That's where all the electricity runs underground, just in that specific section. So we would still be able to have a show. However, it would eliminate lighting from Second Street, and it would primarily be, like I said, the north. Did I say northwest? I meant northeast corner.
Northeast.
Okay, northeast corner of the park.
Okay, thank you. Well, I do think it's important for people to recognize that 25 years ago, it was less than a dozen trees running on a generator. The size and scope has obviously increased over time, and so that precedent has been set, but surely we're going to get some grief if we support going to just 30 lighted trees from 67. But it's important for the community to recognize, I still think, that that's still 3 times bigger than what we were doing 25 years ago. That being said, I like hearing that we would be more aggressive with seeking private sponsorships and other avenues towards maintaining the status quo from last year. And I would ask if it's simple that we have maybe even a web page on the city website, like whatever we can do that is simple but can maximize that impact. To me, that would entail a city webpage dedicated to the effort with some sort of easy portal or form for people to fill out. If, some little application, I'm interested, I can donate my time, treasure, or talent in making this happen. Or I can put together a group of volunteers to help with our park staff, whatever that looks like. I would like to see, I want the offer on the table. Okay, you're upset if we're reducing 37 trees. Here's every option available for you to help us get back up to that 67 lit tree. And so your mind, I'm sure you've already given some of this thought, but I would support you in that endeavor to, designate a city webpage for it. Some hyperlinks for people like me and others to share, and encourage people to donate if they feel it's very important to them.
And Counselor, you'll be happy to know that that webpage does already exist.
Holy smokes,
It
look at
was
that.
deployed last year, Holiday Square, Festival of 50,000 Lights. And so we utilize that as a tool to educate the public on the types of trees that exist in Conwell Park and give people the opportunity to sponsor a specific tree for lighting. And so that is, I think, how we ended up with such a large response. And we will just continue to build on that, but we will absolutely use your offer to share that with your constituents so that we can drive more traffic to that site.
Thank you.
Amber.
I don't want to get too in the weeds. I agree with Kyle about, soliciting additional private funding, but for me, that should not be going to increasing what we have here. It should be going to further reducing our labor costs. If we have a critical need for our urban forestry here that is more pressing than these lights, we should be allocating as many private resources to the lighting as we can and moving our public resources until our hours are at 0 that are coming out of our staff. Like, that's the direction I would go, which is a less sexy sell than help us light more lights, or light more trees. But to me, like, it sounds like we need those hours. We could put those hours to very good use across town. So that'd be my direction.
Yeah, we would not advocate to expand beyond what we did last year at all. Even if we raised same amounts of money, we would not advocate for an expansion. And I also want to point out that the reduction likely means we won't have an event either. We will pick a date to light the park, and there will not be to do where there's hot chocolate and cookies.
The festival of 25,000 lights.
There. Part of the solicitation, though, I totally agree. I see Amber's points, and especially hearing that it sounds like it did start like it was one gentleman walking around getting sponsorships, and it sounds like the city committed very little in the way of time and resources, and so I agree with that. But since we're talking about soliciting people from the community, I agree maybe the city should, to cut down on expenses, shouldn't hold the big event. But I would like to put the offer on the table if there's a nonprofit or some other partner in the community that wants to provide the hot chocolate and do those things. Reach out, like, let's make it happen.
And to that point, those were in-kind donations last year, the hot chocolate and the cookies.
Ramcota.
They have several years they have done that, so.
Well, yeah, if there's any nonprofits or otherwise that want to partner with us to staff that and volunteer for the event, let's do it.
So I'm a little confused because we're gonna give direction. So I think the direction needs to be, just my opinion, whether to do it at all, which I think would be a huge mistake. But I think not to do it. But I think we need to give clear direction, just my opinion, that we'll do the 30 trees. That's part of this. And, you know, still try to solicit donations, but growing it back up to 67, I don't think that's the kind of direction in my mind that's needed for a clear message back to the department. And I'll also say I didn't watch a lot. I was mostly focused on labor health that was here in town, but I did watch some of the testimony today on appropriations. And when Chairman Bear, Commissioner Scott Clem, a former legislator, was testifying about property tax, Chairman Bear basically indicated that it was, this property tax was de minimis in nature. In most communities, it was only 1% to up to 3%, which he doesn't see as recognizable. So I don't think this next budget isn't going to be very kind. I just reading between the lines to as far as any kind of direct distribution. My guess is that's going to be, and when the camera kind of spun to the one end of the dais where Pentagraph was seated and Representative Alaman. At the end of the dais was a Wyoming Doge hat right prominently there on camera, seated, and plus two bubble heads that I don't know what those statutes were of in a red suit. But so I look for more things to come. I think the 30 trees is probably what we can afford to do.
That's probably your recommendation, I imagine, will be outlined. Okay. So it sounds like everybody's okay with saving the Holiday Square with the recommendation of, I don't know why I'm continuing looking at you, Amber.
Yeah, I think, you know, in light of that too, I say we take care of our trees because it's going to be harder to do next year and the year after that and the year after that. So, but I think I will lose that vote, which I'm perfectly fine with. But I, you know, as we continue to think about the way things are going and in the future, I just think that spending those hours and that money on our most critical needs gets more and more important. But I'm happy if it goes to the 30 trees, I will be happy that that amenity and that opportunity still exists for the community, even if I voted no for it.
Kyle, were you going to say something?
I think Councilor Pollack's concerns are warranted, but I would advocate that we give the recommendation to Zulima and her department to aim for this limited scope, 30 trees and the other stuff they've outlined. Be as aggressive as possible with soliciting private dollars and private contracting and donations along those lines to try to achieve cost recovery And insofar as we reach that and have, donations above and beyond, they can be used to enhance the event beyond the 30 trees, this limited scope of. That would be my position.
Guys feel good?
Same thought.
Sounds about everything. Okay. Is council okay with that recommendation to move forward with this? Okay. Yeah, go ahead, Pat.
Is it clear enough?
Is it clear enough?
It's as clear as you're gonna get from me.
So what I'm understanding the direction to be is that we start with the intent of the 30 trees and the lighted amenities, be aggressive in our fundraising efforts. And then if we see a surplus, we can allocate that surplus to contracted labor that would take the burden off of our staff. Is that what I understand? Or would that be to add more than the 30? Because I think my recommendation would be that then we start trying to deploy those funds to reduce city labor so that we can do additional maintenance.
Yeah,
work.
I think we should solicit as much as possible. And if we reach the point that through donations and, proposals from the community, we're able to reach cost recovery with city, completely eliminate the cost of the city labor if there's an excess of that, which would be great. Maybe it's optimistic, but people really want to see the holiday tree lighting stay the same as last year. Give them that opportunity. We have to cover our costs, but anything beyond that, if it's possible.
I think 30 trees is where we're at, as far as that goes, so. Okay. Sounds like you got direction.
Thank you.
All right, thank you.
Thank you.
Okay, starting to wrap up here. Agenda review. Carter, do you have anything for us?
Mr. Mayor, recognizing we still have a special meeting, I would be happy to pass on that if that's okay with you guys.
100%. Is everybody okay with that? So we can move forward. Okay. Okay, council around the table. We'll start with Kyle.
What? You doing that?
That's it. I'm doing it.
All right.
Are you ready?
Yeah,
Oh,
all right,
okay.
thanks. Like I stated earlier, we had a joint OID, DDA, DCBA meeting last night. Pat, Councilor Sweeney and Councilor Jensen were there. I think that was everyone.
Liz.
And yeah, Liz, community development. Like Kelly said, Liz very involved. A lot of things hinge on her participation. We introduced the group to Melissa Huguet, new executive director at DDA. We got a report from Captain Dabney at the police department about increased community service officer presence for parking enforcement. And the business owners, merchants, all responded very positively to that. They were glad to see the additional presence over the previous week. And in their experience, the more police presence we have downtown, the less issues they have with folks experiencing homelessness and some of the other potentially criminal acts. They like to see an officers walking around, was kind of the consensus. There was some education about the alleyway design this year. We had Alex from engineering join us, and he gave a presentation about our allocation to redesign alleys and reconstruct them. That will likely occur. We'll do the design this year, and then it'll likely be budgeted for fiscal year 27 and probably carried out summer of 2027. So maybe it'll be fiscal year 26 budget. There'll probably be some overlap there, but so yeah, hopefully reconstruction of most of those alleys here in the next couple of years. There was discussion about summer events, including a presentation from Sean Hauk regarding a Oil City News weekly paper that will be is going to be published and will be released on Parade Day. So I'm pretty excited about that, and the focal point of that paper is going to be community events. So there was discussion about, especially in the summer months, the nicer months, there's a lot of conflict between events. And so there's always been this push to get a centralized calendar so that people aren't stepping on toes and scheduling over other people's events, especially if they're like or similar events. And so I would encourage people, at the very least, you need to create a Facebook event page, and the Oil City News community calendar scrapes Facebook for those events. And so it will be a good centralized source to hold all of our community events that doesn't require much time and effort on the part of the organizers. So I would encourage people to use it because it's a resource I hear about in a lot of event planning groups often. There's lots going on in the month of July, part of the reason I bring that up. And then also folks were just reporting homelessness, not really seeing much of it during these past couple weeks. Again, could be part police presence, could be we had a lot of people walking around downtown, and it seemed to be the consensus that the more people you have in the area, the less you see of that kind of activity. So that was interesting to hear, because usually around this time of the year, we see spikes in that kind of activity. One of the asks from that group was whether we might be able to add a list of alcohol establishments and their associated liquor license on the city website. It came up during the discussion about open container ordinance, people being confused about which establishments can participate. And because only establishments with a retail liquor license or brewery or distillery license can participate, you can't, no restaurant licenses, no bar and grill licenses can participate in open container. And so people just were wondering, you know, they wanted a list to know of where can I go to get a container, a beverage that I can walk around downtown with. So I don't know if that's something we can easily make happen. I imagine that list already exists in some form. So if we can maybe just add it as an addendum to our liquor permit webpage, something like that, just a resource so people can go to and say, you know, and see, these are all the establishments downtown that are likely participating in an open container. It also sounds like we'll have a discussion next year about expanding the boundaries. Again, we expanded it a little bit this year to include Nick along the rail trail, but also we've heard from some retailers specifically north of 2nd Street that they would like to participate, but because the northernmost boundary is 2nd Street, they're unable to. So we'll probably have a discussion about that next year. I would encourage people to pay attention to how it goes this year and come with any thoughts, questions, or concerns to that discussion we'll surely have next spring. And then I had a Casper Housing Authority meeting today. I don't give these numbers very often, but I think it's important for people to know, especially in light of the presentation we got from Kelly. They are currently utilizing 589 vouchers, which is a little low for this time of year. They're also utilizing 40 EHV vouchers, the emergency housing vouchers. It was reported at our last meeting that their Father's Day event went really well. A few thousand people, definitely more flowing through than years past. We had our meeting today at the new Overland Trail location. They've done a lot of work to that building, so it's looking really good. They always do a great job rehabbing older facilities. They did close on Roosevelt High School on June 11th. The new owner is an organization called All About Families. My understanding is they work with adults with developmental disabilities, and they'll be using that as their day hab facility. And AmeriCorps members that they hired through a generous grant from Zimmerman Family Foundation. They're still on site working at Urban Thistle Farm, and I think they expect to have them for a couple more weeks. That's all I got. Thank you.
Pat, do you have anything tonight?
You do.
Wendy?
I don't know. I only have a couple things. CNFR is a wrap. So that was fun. Thanks for all the city council members that made it out to the government night. It was a good show. Stayed until they handed out all the saddles and everybody went home. So that was a long night than the last night, but it definitely a lot of fun, a lot of energy.
Sold out again, right?
Yeah, I haven't, I think it was, but I haven't
So
I haven't
it had-
officially got any
and
numbers.
Somebody
says
told
yes.
me today that they went up expecting to be able to buy a ticket Saturday night, and it was sold out.
Yeah, that was, but I haven't officially received any of their counts yet on that, but yes, it was definitely full and hard to find parking, and it was packed, so it was good. I was just at that meeting that Kyle spoke about, and then coming up this week, I have a art meeting, which is public. I'm gonna get it, public art response team. Right, is the name of- yeah. And so that's tomorrow, and then I also, or
You gonna talk
that's
Grand
on
Junction?
Thursday. I also have a river revival meeting coming up too this week. What was it?
I brought up several weeks ago when I was in Grand Junction, their downtown public art initiative.
Oh, yep.
Just
Yeah.
Bring it up.
if it comes up organically.
I already did
Okay.
talk
Sure.
about it because I was sending, whenever I go on these little getaways that I go, I take tons of pictures of all the art and everything, and I send them to Liz just because I think, oh, this would be a great fit in Casper, you know, and so, yep, they know, so I'll share some more, but I'm always looking for good ideas to enhance Casper. So that's it.
Michael.
Not much, just I have a homeless coalition tomorrow and same part meeting on Thursday as well. I noticed in the paper somewhere that Sheridan has a pretty active public art presence as well, so.
Yep, they do too.
Look at as well.
And so does, Sheridan.
Sheridan, yeah. So does Sheridan.
That's
Sheridan
the one.
does too.
They do.
What a coincidence.
Yeah, because they do the Christmas stroll and it's all through downtown, which is also really beautiful. And it involves a lot of the DCBA shop or their downtown Main Street shop.
And then just one, I had a question about the, Amber, I don't know if you're MPO and Kyle?
Me and Michael is the alternate.
I just was wondering if we'll get any kind of a feedback about the Robertson Road corridor meeting that was held. I'm really curious about that. I wanted to attend as well.
I'll check in with them.
Yeah,
and see.
I'd be just curious about, if we could just get a summary of what some of the questions and comments were at the meeting.
Sure. Did it come up at the meeting?
Just that they had some great discussion on it.
Okay.
Okay,
Yeah.
no detail. Okay.
We usually get a pretty comprehensive report, I think.
Yeah.
Even, yeah.
Usually
probably
as part of
maybe-
the stud, like when the study is complete, typically there's
Yeah.
appendices that list most of the public comment, but I'm happy to reach out and just kind of get a summary of what they heard there.
Yeah, if we could just get a hard copy of
Sure.
lists and comments, we're just curious. Otherwise, that's all I have.
Thank you. Was out last week on a family vacation, so thanks to folks who took my place at the responding meetings. Let's see, I can report that Casper Pride went very, very well. Had very likely record numbers at the Saturday event, at least early on before it got very, very hot and some people started to seek shade. But and we had close to 300 people for the march on Sunday, which was kind of coordinated and staffed by the advisory committee. So thanks to all those folks who volunteer on that committee for putting in some additional hours that day to run the barbecue and to participate in the march, and also create an area where folks who were unable or did not want to march could watch along the route. So that group played a key role for that day. I am gonna get the opportunity to tour the cemetery tomorrow, which I think many of you did while I was uptown, but I'm looking forward to that. And then I do have some belated comments in response to Representative Locke's comments at the last meeting. I did watch it and unfortunately wasn't here to be able to give comments, though. It was nice to have a little bit of time to mull it over. There's a couple things in there that I do want to respond to, but I'm just going to pick one for tonight. I might formulate the other one a little bit more, but I'm going to save my comments on the kitchen table sort of framing and discussion for another time. But today I want to address the first part of his comments, which dealt with the proper role of government and his assertion that the city council does not keep the role of government at the forefront of our minds. I want to suggest that this is part of a larger narrative that I've heard being pushed at the state level, predominantly by Freedom Caucus and Freedom Caucus aligned legislators, and at the local level by Casper Doge, Liberty's Place for You, and other similar groups. That is that government exists to provide for infrastructure and public safety only. I'm certain that's an oversimplification, of course, but I think it's a reasonable way to summarize the basics of this particular theory. And I say theory intentionally because this thinking is just one of many philosophies of government. It is not a universal truth as it is being presented to us. While some hold it very strongly as the correct philosophy of government, it is by no stretch the only, most effective, or most valid model. In fact, this fundamentalist take on the role of government has never been the dominant government philosophy in any thriving modern democracy, hence why I say it's more of a theory than an absolute. If that philosophy had defined Casper for the last 100 years, this would be a radically different place. No rec centers, no libraries, no park, no community events, no services for youth, family, seniors, roads, pipes, law enforcement, and not much else. And that's not the Casper we know. It's not the one generations before us worked to build, and it's not the one I hear from my constituents that they want. Our community and its government didn't evolve by accident. It evolved because generations of Casperites showed up, they paid taxes, they built partnerships, and they made government work for them. They believe that government could and should help improve the quality of life, even when we live in a state that values small government. Folks of the past believe that both of these things could be true, and that belief shaped the Casper we live in today. Of course, we should always evaluate our programs, services, and facilities. If something no longer serves the community, we should absolutely leave space for it to evolve or end. But the folks who are championing this dramatic and narrow version of government are advocating we hand off decades of community investment to some imagined private sector solution, privatize it, sell it to the highest bidder, and let the community buy it back at a markup if they can afford it. To me, that is nothing short of a dereliction of duty to the community and the taxpayers before us who made it so that we could have a wonderful community to live in today. Casper has proven time and time again that great things are possible when the community comes together in partnership with government and the private sector to together create this place. We should be proud of that. And we should be wary of folks who suggest that we've been doing it wrong all this time and who seek to strip our community back down to its studs in pursuit of an imagined private sector purity. I'm confident that we will all continue to hear more arguments related to this philosophy, and my hope in bringing attention to this now is that the council and the community will meet those arguments with the appropriate degree of scrutiny rather than blindly accept them as the one true path to good governance.
Vice Mayor.
So, like Amber said, I substituted for an MPO and Dave North managed to get Amber
I heard
voted in as chairperson.
it was Dave.
Dave
Good
did
to know.
it. Cemetery tour. Pat and I went on the cemetery tour. It was enlightening. It's been a while since I've walked around the cemetery, so I was amazed at the cemetery, the great job they do over there taking care of things. It's got the typical Wyoming spring brown spots here and there, but they're working hard on getting all that looking good, and it's definitely looking good, don't you think, Pat? So thanks to CNFR, government at night, I talked my wife into attending. She wasn't too sure about rodeos, and now she's a big fan, so we'll probably see more of it next time around. I agree with Amber's comments. You know, I've spoken to some of the legislators, and a lot of them, their opinion is that for the past 50 years, government has tried very hard to make Wyoming a very business welcoming state. And now it feels like this legislator is just hanging out a big closed sign telling businesses we don't want you here. And I don't think that that is what true Wyomingites want. So thank you for your comments on that. I've noticed that I lived in California for a few years. I've noticed that the Freedom Caucus are now wearing red suits. In California, that tells you're either a Norteño or a Blood. So curious as to what gang affiliation they are affiliating themselves with. Just a sarcastic side note. So that's all I've got.
I don't have anything. Next Monday, I have a swearing in for the police department. Several of those, and then I have a swearing in on Thursday at the fire department. Awesome. So I'll be doing those. I'm looking forward to that as well. That's all I got. So now we go into our special meeting. Before we begin this evening, I'd like to remind everyone to please silence your cell phones. Council meetings are live streamed on the city